Hi, this is Dr. Christy DeSapri, founding physician of Bone and Body Women's Health, coming to you with an update from the Menopause Society 2024. We had a great lecture from Angela Fitch, who's professor at Harvard University, as well as the president of the Obesity Medicine Association. So we know that the rates of overweight and obesity are staggering in this country, and how are midlife women impacted? Well, we know there's a lot of body composition changes, and in fact, 70% of women will gain 10 to 15 pounds through the ages of 50 to 60. What's happening with both natural aging as well as hormonal changes is that we need to think about decreasing our energy expenditure. So we know that when there's decreased energy expenditure, we need to decrease our caloric intake, and that's generally thought to be about 250 to 300 calories per day. We also know what's happening is there is a decrease in our lean mass or our skeletal mass, and an increase in something we call the visceral adipose tissue or visceral fat around the organs, etc., and making us less metabolically active. Insulin resistance is a really significant because it impacts so many different systems. So when we can't use our glucose appropriately, that gets deposited in things like our liver, causes in our skeletal muscle, it causes metabolic dysfunction, it causes prediabetes and diabetes, cancers, cardiovascular disease, and even Alzheimer's dementia. So what can we do at midlife? So the first thing is, if hormone therapy is inappropriate for you, we can have a discussion about that because we know hormone therapy decreases insulin resistance. We also know that strength training needs to be your new best friend. So finding a time to do active strength training at least 2 to 3 times a week, whether in a class, whether with a personal trainer, on your own, to really change the composition of your body to more skeletal mass, more lean muscle mass, less of that free fat tissue that can be, again, really affect your metabolism. We also know choosing fueling foods are so important. So things like high protein foods, protein takes longer to digest, fiber foods that are going to make you feel fuller and stronger. And again, all of these also support muscle and bone. So very important things that we can use at midlife. There are also a lot of weight loss medications that are safe and effective. We're really advising against compounded of medications like things like semaglutide, as we know, again, the safety and efficacy are not correct there, but we have lots of oral medications, injectable medications, some great professionals out there to help with those things, and I am prescribing those as well for patients who really do meet criteria. So lots of ways that we can think about menopause, think about midlife, think about our metabolism and our body composition in ways that really help serve us. I hope to see you soon.